Hello, I'm Dr. Aizaz from MedicoVisual.com, and in today's visual lecture we will talk about intramembranous ossification of the bone. So in the last lecture we had seen that the mesenchyme, it condenses to form mesenchymal membranes, and these membranes, what can happen with them is that they can convert either into cartilage, and then these cartilages, they then may be replaced, not converted, they are replaced by the bone. This is one way of bone formation. The second way is that we can just eliminate, for the simple bones, we can eliminate the formation of cartilaginous model, hyaline cartilaginous model, and directly within the mesenchymal membranes, directly the ossification centers develop and they coalesce to form the bone directly. So this method where the within the membranes, intra means within membranes mesenchymal membranes. So it is the method intramembranous ossification of bones is the type of method of bone formation in which there is no formation of the hyaline cartilaginous model, but rather the mesenchymal membranes or mesenchyme, it directly forms the bone. There is no in between, there is no formation of cartilaginous models. And of course, if there is the formation of cartilaginous model, then this type of ossification is endochondral within the cartilage, endochondral ossification. So in today's lecture, our focus will be this intramembranous ossification of bone, and basically we will see the steps of formation. We will see how exactly the bone forms within these mesenchymal membranes. So today we will discuss the steps of intramembranous ossification of bone. So let's start from the very basic concept that we had already seen in the previous lecture, that mesenchyme consists of these irregularly shaped cells, lots of irregularly shaped mesenchymal cells which are not closely opposed, not opposed, opposed. These are not closely opposed to each other. They are widely far apart, they are loosely arranged, and they are loosely interspersed between a ground substance. So this ground substance is the background one is the ground substance, which mainly consists of water, some proteins, gel-like material is this basically, and it consists of collagen fibers as well. And by the way, it is very similar to connective tissue. In fact, it is itself the connective tissue. So mesenchyme is basically the embryonic connective tissue. So within this embryonic connective tissue, what actually happens that these mesenchymal cells, they first proliferate, and then at some places where the bone has to be formed, at those places these membranes, they condense, they come close together like this. They condense, you see, they condense, they come close together, and they have formed sort of membrane like structures. So here you can see these porous, highly vascular. In this diagram I haven't shown the blood vessels, but actually there are lots of blood vessels that will develop here. So these are highly vascular condensed mesenchyme, or basically these are highly vascular condensed mesenchymal membranes. And within these highly condensed mesenchymal membranes, what actually happens that some of these mesenchymal cells, they will transform into bone forming cells. So we have these mesenchymal cells, they will differentiate. These are quite undifferentiated cells. They will differentiate it into bone forming cell, and by bone forming, the technical name of bone forming cell is bone forming cell. They are called osteo. Bone is osteo, and forming is genic, osteogenic cell, or another name, a rather more common name, is osteoprogenitor, because they will Actually, they are called osteoprogenitor cells because they will form those cells which will actually form the bone. They are the stem cells, even they are less differentiated. These are not fully differentiated. So they are called osteoprogenitor cells, which are basically, truly speaking, they are precursor of bone forming cell. To be very precise, they are precursor of bone forming cells. Some literature I have seen that they directly call these cells as bone forming cell, which is not totally correct. If you oversimplify it, yes, you can say that, but it is not entirely correct. To be precise, these are progenitor cells, osteoprogenitor cells, right? So these cells, they will transform into osteoprogenitor cells, and then those osteoprogenitor cells, some of those cells, they will transform into osteoblast. Osteoblast, bone forming cell, osteoblast. Now here I will draw a side diagram to explain something important. So some of these cells, they will transform into osteoblast, and osteoblast, we can say they are polarized. Now what I mean by this word polarized, I am uttering this word polarized here because in the literature you will see this word written. For example, in Gray's Anatomy, this word is widely written that these cells, these osteoblast cells, these are polarized. And by polarized, I mean that there is an apical side and a basal side. Now these cells, they will secrete an osteoid material. Osteoid is basically the bone matrix, the ground substance of the bone, right? So they will secrete the bone matrix from the apical side. So this is the apical side. They cannot secrete it from the basal side. Let's remove this here. So I will show you something. So what it will do, what these osteoblasts will do is that they will secrete the ground substance of the bone, which is called bony matrix, from the apical side. And how exactly it happens, that is beyond the scope of this lecture. That I might discuss someday in biochemistry, or maybe I won't go into those details, who knows? But anyhow, let's not go into those nitty-gritties. But the bone matrix is released here. From this apical side, bone matrix is released, right? So now let's suppose here is another cell here that will also release bone matrix like this. Now what will happen for some of these cells, not all, but for some of these cells, if I hide this. So, for example, this cell is here. For some of these cells, although they are secreting, it is secreting. This is, let's say, one cell for the sake of understanding. This is one cell. Even if it is secreting from the one side, the apical side, it is secreting the bone matrix. It might happen that this bone matrix, lots of bone matrix is released, and it might happen that this bone matrix, it might ultimately completely surround this cell like this. So this cell might get completely surrounded by the bone matrix. Or the second possibility may be that it is not surrounded. So let's say there is another cell, another osteoblast, and let's say it is not completely surrounded by matrix, only matrix is here, then there is another cell, so matrix is here, so like this. So here exactly, if you look carefully, here the matrix is only on one side. It is this cell is not completely surrounded by the bone matrix. That is very important. So now two types of osteoblast are there. One osteoblast which has been now completely surrounded by the bone matrix. The other is not completely surrounded. So this type of osteoblast which has now been surrounded completely by the bone matrix, it changes its shape. It becomes a bit different in shape, right? And then it forms some processes like this, right? Yeah, so it forms processes like this. Now this cell, it is said to be transformed. Now it is no more the osteoblast. No, it is said that it has been transformed into osteocyte, bone cell, osteocyte, mature bone cell. And similar to that here, what is happened? This is not similar. Actually, I should say opposite to this situation. Here, what is happening that these cells, they are lining the bone matrix. So let's suppose bone completely forms here, and here they will be lining the bone. So now these osteoblasts, now they are changed into bone lining cells, which are lining the surface of bone. Actually, their shape will also change. So let me exactly draw here. They will become a bit flattened, you can say. They will become a bit flattened, and you can say in a sense that these are basically inactive or quiescent type of osteoblast. These are inactive or quiescent sleeping. These are sleeping osteoblasts. They will remain there flattened, right? But whenever there is need of bone formation, for example, even normally during the normal bone turnover, they will become activated and they will transform back into the osteoblast, right? And by the way, osteocytes, they are very important for maintaining the structure of the bone. They are not just lying there and sleeping. They are doing many important tasks. They have many different roles that we will not discuss in this lecture. That is again beyond the scope of this lecture, that I might discuss in histology but not in this lecture of embryology. So in a nutshell, what we can say is that the osteoblast, it can form either the osteocyte, or it can form the bone lining cells. In textbooks, you will just see this line written that osteoblast can transform into osteocyte and bone lining cell. But here I wanted to exactly explain how it happens. So with this diagram and with this explanation, I hope your concept will be very clear about this. So now here I created the simplified animation. So here what happens that some of these cells, some of them, as they more and more of them they proliferate, some of these cells again they will transform, these osteoprogenitor cells, they will transform into osteoblast, and these osteoblasts, they will start secreting the bone matrix like this. So this orange one is the bone matrix. Now here I want to clear one thing important. You see within this membrane, the bone matrix is being released, right? So bone is being formed within this membrane. This is important. That is why it is called intramembranous ossification. That within this mesenchymal membrane, the ossification centers have developed, and multiple ossification centers have developed. For example, here you can see this is ossification center number 1, 2. Of course, they are not numbered. I'm just arbitrarily numbering it like this so that you can understand what is going on. So multiple ossification centers develop. They will form multiple irregularly shaped bones here. You see irregularly shaped bones are being formed here. And by the way, these projections or these spicules, as they say, spicules, here you see, let's draw it with black color. Here you see these bony spicules are formed here. Here as well. So here as well, these bony spikes or spicules are formed here. So, of course, it is a two-dimensional illustration, but in reality, it is happening in 3 dimensions. I will also show you the 3-dimensional diagram as well, 3-dimensional model as well. So what I want to tell you here is that these bony spicules, they are formed within these different intramembranous ossification centers. The bony ossification centers, the bone formation centers. And these spicules, they can then fuse with each other. For example, it can fuse here, it can fuse here, and it can fuse here. So ultimately, all of them will fuse together to form a single network of bone, right? So you see, they will fuse together, and of course these cells, they will also form the collagen fibers. These cells, they will also form the collagen fibers. They will form mainly type 1 collagen. I just remember there is a very beautiful mnemonic taught by Dr. Najib. He says that how can you remember that bone has mainly type 1 collagen? Of course, there is type 10, I think, and type 9 as well. So there are different types of collagen fibers here, but mainly it is type 1 collagen. So you can remember it like this. You just write bone, bone, bone. So bone, and here it is 1. So type 1, B1, bone B1, type 1 collagen, collagen type 1. So type 1 collagen is released by these cells. So yeah, so here this collagen fibers are collagen fiber is released, and they fuse together to form everything here you see. Now, few things that I want to teach here. So first of all, within this matrix, you see there are some of these mesenchymal cells here. These are these mesenchymal cells. In some bones, in some long bones and some short bones even, these mesenchymal cells, they will transform into the what we call as bone marrow. They will form the bone marrow. But in some of the flat bones, they might simply be destroyed. They might regress and they are lost simply, right? So in this case, let's suppose we are forming the flat bone. So in this case, these cells might get lost. So now you see the structure of bone that is formed here. Now we have some problems here. Let me explain. But before that, of course, these cells, they are not within these cells. You see, some of these cells, they get trapped. Some of these cells, some of these not osteoprogenitor, some of these osteoblasts, they got trapped within the, let's watch the animation again. So some of these osteoblasts, they got trapped as the matrix is formed. Some of these osteoblasts got trapped within the matrix. You see, these osteoblasts got trapped within the matrix, and these trapped osteoblasts, these are now transformed, these are now differentiated into bone cells or osteocytes, mature bone cells. Of course, they are not truly represented here. Their shape will change. They will have some projection outward like this. They will have some projections. I will show you in 3D as well like this. So they have this type of shape. And of course here these cells, all these cells, all these cells are what? These are bone lining cells. All these are bone lining cells. All these are bone lining cells. I hope you can really understand this thing. I hope no one is confused about this. Yeah. So now there are some problems that we need to address. Rather, nature needs to address. So, number one, the collagen fiber is weak. Collagen fibers is weak, and you know, collagen fibers are weak, not is, are weak. Collagen fibers are weak. Why they are weak? Because they are not reinforced by some minerals. So these collagen fibers, they need to be reinforced by some minerals. So what will happen that sodium So what will happen that calcium phosphate crystals will get deposited within the collagen fibrils. Exactly where, actually I will again not go into details, but within these fibrils there are some spaces, and within those spaces these minerals can get deposited. These are called hole zones, if I remember correctly. Yeah. So within these collagen fibers, these minerals, hydroxyapatite minerals, hydroxyapatite hydroxyapatite crystals, which consist of calcium and phosphate. These crystals, they get deposited within these collagen fibrils, and these collagen fibrils combine to form collagen fibers. Again, that is beyond the scope of this lecture. That is histology that we will discuss some other day. So with this strengthening of collagen with the help of these hydroxyapatite crystals, the collagen now acts as the steel reinforcement. You see, on the top of roof of the buildings, we spread, not we, the engineers and mechanical workers, they spread these steel reinforcements, and these steel reinforcements, they prevent the buildings and especially roofs from easily collapsing. So such is the structure of bone. It is like the steel reinforced bony matrix. Their matrix is reinforced by steel-like collagen fibers, and that is the beauty of presence of hydroxyapatite crystals. Due to presence of hydroxyapatite crystals, bones are strong. That is why it is said that you need to have sufficient calcium and phosphate ions in your body to have your bones stronger. You might have heard that you need to drink milk to make your bones stronger because milk consists of lots of calcium. So to solve this problem, of course, there is mineralization of bones through a certain process. Certain chemicals are released, certain enzymes are released, these crystals are released, they get deposited within the collagen fibers. Again, we will not go into details. The second problem here is that you see that these collagen fibers, they do not have a proper orientation. They are irregularly arranged. So collagen fibers, if you look carefully, they are arranged like this. One is going here, other is going here. So these are directionless. As some people are directionless in their life, similar to that, these collagen fibers are directionless. They do not have a particular direction. So again, they are mechanically weaker. Not they are mechanically weaker. After the enforcement with the hydroxyapatite crystals, they are sufficiently strong. But the problem is that since they are not following a proper direction, similar to directionless people, they do not have a career. Similar to that, these collagen, again, I am saying collagen fiber. Similar to that, the bone that these collagen fibers form, these irregularly arranged collagen fibers form, such bone is mechanically weaker. But during the first iteration of formation of bone, nature says that okay, I just need the bone, so it quickly forms a basic type of bone, and that basic type of bone has irregularly arranged collagen fiber that is relatively weaker type of bone, and that type of bone is called woven bone. Why it is called woven bone? Because if you look carefully, it is giving an appearance of some woven structure, some threads. You see threads are coming out and stuff like that. I hope you can understand my point. So these are woven bone. This is the woven bone. Woven bone is immature bone. So one problem is there is no mineralization, so there needs to be mineralization of bone. One process is mineralization of bone. Then there is a woven bone. So this woven bone must be transformed into mature lamellar bone, that I will show you how it looks like. Lamellar bone that must be converted. And the third thing is that initially all the bone that is formed, it is spongy bone, it is trabecular bone, it is irregularly shaped bone, it is less dense bone. So we need two type of bone, cortical or compact bone, as well as this type of spongy bone. But initially all bone that is formed is spongy. So at some places, especially at peripheries, what actually happens that the spongy bone at periphery, not at every place, spongy bone at peripheries, it must be replaced by, or it must be somehow converted into, compact, or what we call it, compact or cortical bone. Cortical bone. So one issue we have already discussed. Second, we will talk about this issue, formation of mature lamellar bone from this initial weak primary woven bone, right? And third issue that we will talk about is formation of compact or cortical bone from the spongy bone. So let's take it up one by one. Let's start from the woven bone, right? So let's go to another 3D model to understand these things. So this is the three-dimensional structure of initial woven bone. You see these thread-like structure coming out, and these thread-like arrangement of the woven cloth-like arrangement of the collagen fibers. These are again directionless. They are oriented randomly in the space, in the 3D space. These are randomly oriented fibers. I hope you can appreciate this thing. These are randomly oriented. They are directionless, right? So if I go to a section of this to really make you understand, here we can see, here is the section of it. So here you can see in this model, if I hide it. So this is the more detailed structure here. Here you can see within that you see osteocytes. Let me show you what actually is being shown here. So let's suppose I cut a very small part here. Let's suppose I cut this part here and I zoom into that part. So if I zoom into that part, here that part is being shown. So let me show you here. And by the way, here I have removed these cells. What are these cells? These outermost cells. These are nothing more than the bone lining cells that I have already discussed, that they develop from the osteoblast. These are basically flattened cell. And here you can see within the matrix, within the bony matrix, these randomly arranged collagen fibers are there, and there is no multiple layered arrangement, as we will see later that there is multiple layered arrangement in the mature bone. So here it is random, these are randomly arranged, and of course inside them you can see that osteocytes are there, and osteocytes have these processes which are coming outward, right? So I hope you can appreciate that. Of course, this type of bone is mechanically weaker, so this type of bone, it must be transformed into the mature spongy bone, the mature laminar spongy bone. So if I show you in the two-dimensional here first, so that it will be easier for you to understand that if I cut a section of this bone, first of all, here we will have these randomly arranged collagen fibers, right? Then we have what are these osteocytes here? Osteocytes, bone cells here. They are having these processes, and of course outside it there will be the bone lining cells. Okay, let's draw it with another color. So bone lining cells. These are somewhat flattened cells. Now what actually happens that osteoclast will come. Of course, this is a vascular structure, and by the way, here you see that there will be matrix all around. So matrix will be there, the ground substance will be there, right? Now, you know that we have what we call as the osteoclast. You know, this is a vascular substance. So from the blood, not osteoclast, actually some cells, you know, there are monocytes. And from monocytes, osteoclast might develop if certain factors, for example, rank ligand and all these things that we will not go into details, certain factors are released, then what will happen that monocytes from the blood, they might lodge here, they might come into the bone, and they might form the osteoclast. Now basically osteoclasts are the cousins of macrophages. These are very similar to macrophages. So what they will do is that they can dissolve the bone. So osteoclasts are here, they can come here and they can dissolve the bone. So they will gradually start dissolving the bone, and gradually osteoblast will lay mature layered type of bone. So this is called bone remodeling, and this goes on throughout your life, and it is very precisely balanced process. It is very precisely balanced process that at one end there is the presence of osteoblast, osteoblast, and other end there is presence of osteoclast. Osteoclast will remove the bone, osteoblast will form the bone, and these are coupled together. This is the process of coupling of osteoblast and osteoclast. So bone formation, bone resorption, coupling is this is called bone formation, bone resorption, coupling. This process is coupled. Of course, if it fails to be coupled like this, if osteoclasts become hyperactive, osteoblasts are not working well, then bone resorption will be excessive, bone will become weaker, and so on. Even if the osteoclasts become weak, osteoblasts become higher in function, hyperactive, even then bone will become weak. Bone will be very hard, and that very hard bone will be not very precisely formed, not well remodeled bone, not very mechanically stronger. Although it might look stronger, but it won't be mechanically stronger. Like some fat people, there are some fat people who have lots of I'm not fat shaming anyone, I'm sorry about that, but it is just for the example that some fat people, although they look strong, but because they have lot of fat percentage in their body, their fat is made up of fat, I mean lipids, and it is not lean muscle, so that is why they are weak. So the if the osteoblast is doing all the work and proper remodeled bone, proper strongly modeled bone is not formed, that is called osteopetrosis. And that apparently strong bone might look strong, but actually it is weak. That might lead to pathological fractures. Well, that was beyond the basic medical sciences. I just remember that clinical correlate, so I told you here. But anyhow, the thing is that osteoclast will remove the bone and osteoblast will form the bone. So let's suppose at this specific place, this bone is removed at only this specific place. This bone is removed, and now gradually, since the osteoblasts have some time, they are not very quick to form randomly oriented fibers, so they will form properly oriented fibers, and that too in layers. So let's suppose from outside to inside, let me show you. So from outside to inside, osteoblast will lay the bony matrix with particularly arranged fibers having a particular direction, right? So they will release the bony matrix with fibers having a particular direction. Then more osteoblast will come. They will form another layer like this. Then another layer. Then yet another layer will be formed. Then yet another layer, and so on. So layered arrangement will be there. I will show you in 3D. Don't worry about it. I will show you in 3D here. So here you can see layered arrangement will be formed. And if I show you the cut section, here you can see the proper layered arrangement. Yeah. So you see these osteocyte, basically initially they were osteoblast. So these cells which are inside, which are deeper, they have been transformed into osteocyte. One layer, two layer, three layer, and of course in between them is this matrix which consists of collagen fibers. And these collagen fibers in one specific layer, all of them are oriented in single direction, but in the other layer the direction might change. um, I am talking in the air, so let me exactly show you what I mean by this. Let's suppose what I am gonna do is that we pick the inner layer and okay, let's draw it here. What we will do is that with, let's suppose, a hand, it is not happening actually inside the body. This is just for the sake of understanding. We pull this inner structure, this innermost layer, and then along with that other layers will also come out, and there will be a gradual arrangement. Let me show you like this. And by the way, here I also removed I peeled off this bone lining cell layer. These are the bone lining cells. So here you can see. So now if you see that this layer, this innermost layer, all of these collagen fibers, these are particularly arranged in a particular direction like this. So all of them are arranged in a single direction. These are not misdirected and randomly oriented. All of them are arranged in a particular specific direction. But in the other layer, it's not necessary that in the other layer the collagen fibers will also be arranged like this as in this layer. But in the other layer, the direction might change. Actually, direction has been changed here. Then here, direction has changed. Then here, the direction has changed. But in a particular layer, in a specific particular layer, all of these fibers are arranged in a specific shape. And you see that these processes of osteocytes are there. I hope you can appreciate this. Isn't it beautiful? I love this. Wow. To me, it looks eatable. I want to eat this. I don't know how it looks like. I remember someone was commenting that this is some kind of fancy flashlight. No, man, it's not fancy flashlight. It's a spongy bone. It's a mature laminar. It's not laminar, lamellar. Layered. Lamella means layered. So mature lamella. Lamella is layered. Lamellar bone, mature lamellar bone, and it is spongy bone. The only difference in this microstructure, in if we talk about microstructure, of course not macro, in this microstructure, the only difference between the mature spongy bone and compact bone when it comes to microstructure is the presence of this blood vessel here. So here we have these special canals called Haversian canals, and within these Haversian canals, blood vessels are there. The nerves as well as blood vessels, the arteries as well as veins as well as some nerves are there, and these are interconnected with the other ones that I will show you later. And here there will be another such structure. These structures are, by the way, called osteons. So there may be another osteon, so it may be connected, it will be rather connected to blood vessel of the other osteon, right? So this is the basic structure of spongy bone. And if we grossly look here, the spongy bone, of course, it is less dense. You see, it is network of bony structure. Trabecular network is here, but of course it is not very dense. By being less dense, I mean that you can see that there are these certain gaps here. You see, there are these certain gaps. If the bone is very dense, it won't have those gaps. And we don't need a highly dense bone all around, because the mass of bone will become massive. Mass will become massive. I mean, mass will become very high. So that heavy bones, we don't need very heavy bones. We need to find a balance. So at some places within the same bone, basically deeper tissue of the bone, they are made up of spongy bone, and the outer cortical tissue, they are made up of highly dense compact bones, and we will see the compact bone. So I hope you are clear about the problem number one. So problem number one, that is that there is the immature woven bone. This immature woven bone is converted to mature lamellar bone, and this process is called bone remodeling. This process, it occurs throughout our life. The bony remodeling, it occurs throughout our life, and it is gradual process. It's not like that osteoclast will come and osteoclast will remove whole this bone, and then whole this bone will again be formed with the help of osteoblast. No, it's not like that. It's like that for example, some osteoclast will first remove this bone and osteoblast will form a lamellar bone here. Then some osteoclast might come here and remove this bone and new bone from here. So gradually it is replaced, right? Otherwise the whole structure of bone will collapse. That should not happen. So this is gradual process. So even in your body right now, lots of bony remodeling might be going on right now, right? So that's very important process. So one solution, that this weaker bone, mechanically weaker woven bone, is converted into stronger lamellar bone with the help of bony remodeling. The other problem we are facing is that we do not have any cortical bone. Initially, all bone that is formed is the spongy bone. So we need to form the cortical bone, and how it forms, that is also the beauty of bony remodeling, but that is a little bit different type of bony remodeling that we will see in 2D. Let's go to the 2D illustration to see how it happens. So let's suppose that here we have these outer parts of the spongy bone. Of course, some blood vessels will develop here. Now within these small gaps, some blood vessels will develop here, and these bone lining cells, they will transform into osteoblasts. And these osteoblasts, they will start secreting the bone layer by layer. So one layer, then second layer, lamellar arrangement, third, fourth, and so on, like this. So these gaps will close, then here also this process will occur. And then what will happen, that osteoclast will come, they will start removing the old spongy bone in between them. You see, in between we are still having the spongy bone. We have formed these osteons, but in between we are still having the spongy bone. So they will remove these. In between, the spongy bone will also be removed, and of course along with that some earlier formed osteons, early compact bone, that is also removed. So new bone is formed like this, and this process continue to go on and on and on. Ultimately, at the peripheries, whole of this spongy bone, it is transformed, it is remodeled into compact bone. It's very simple as that. To understand, it's very simple. Of course, if you want to go into nitty-gritties, that might be complex, but for most of the people watching this video, especially the undergrad students, you don't need to go into details. Most of the textbooks, they just skip over this topic altogether. But for the sake of concept, I think you must know this, that how it is going on. And by the way, let me give the shout out to Netter's Embryology. Netter's Embryology has drawn amazing illustration of this process. They have explained it in a beautiful way, so you can check that book as well. So now this was the basic idea. If we go into the 3D structure of the compact bone, by the way, I haven't created this model. I have picked up from the Wikipedia. Here you can see the citation. So here you can see that, let's suppose this is the osteon, and let's suppose we have pulled up this osteon outward like this, and we are looking at it. So you can see lamellar arrangement here, lamellar arrangement of osteons and bony matrix, and of course inside it we have these Haversian canals, and these are Walkman canals. You will learn these things in histology. It's not the topic of embryology. So, but of course you have got the basic idea. So from the outside, the outer cortical part is this compact bone. It is highly dense. You see there are almost no gaps in between. But here if you go deeper in the medullary part, you will see the spongy bone. So in this 3D structure of the flat bone, you can see that inside it is like a sandwich. Inside we have this not meat, we have this spongy bone, which is also called diplo. So inside we have this diplo or spongy bone, and outside we have the compact bone here as well. So diplo is sandwiched between the compact bone, and this compact bone, these are also called tables, outer table and inner table. So between the table we have the diplo. Diplo is spongy bone, table is made up of compact bone. Of course outside it is the periosteum as well. And periosteum, by the way, it is the outer covering of bone, and it is again made up of mesenchymal cells. So I think that was all about intramembranous ossification of bone. Thank you so much for watching this video. Have a great day. Goodbye.